Ooh, diaper tips. My name is Dr. Wong May Foong. I'm a consultant pediatrician at Klinik Pakar Kanak-Kanak Wong in Puchong. Today, I'd like to talk about a very important topic, and this is called diaper rashes and how to prevent diaper rashes. What is diaper rash? A diaper rash is actually any rash in the baby's diaper area. And how common is this? Well, actually, every baby has to wear a diaper. In fact, all children will go through 4,000 to 7,000 diapers a year until they are toilet trained. So how does diaper rash look like? You will see the baby's bottom, initially a beautiful soft and delicate skin, becoming more and more red, forming patches. Then these patches actually become very red and angry, becomes irritable, and the baby gets itchy and crying. At its worst form, it will become broken skin. In fact, it becomes open wounds. And that stage is very severe baby rash. What causes all these nappy rashes? How does it become so severe? Nappy rashes are due to prolonged skin irritation from urine, which is in close contact with the skin. This urine is actually collected in the diaper area. Sometimes there's also fecal material, which has been collected over time. Babies have a lot of poo and peep in their early months of life. And there are periods where parents, the very, very tired parents, may just fall off to sleep without changing the diapers. So in those instances, actually, the diaper rash becomes very difficult and very problematic for the parents as well as for the babies. So how do we prevent this? Well, number one, for diapers, we have to keep the skin clean and dry. One way to keep the skin clean and dry is to frequently change the diapers. The other way is to use a very good quality diaper. Good quality diaper will keep water away from the baby's skin. And new technology has made nappies into such good quality material that the baby's skin will be totally protected from a wet diaper. Look at this diaper, which is made of multiple layers to protect the baby's skin. The first surface layer which touches the skin and has to be delicate on the baby's skin. The next layer will have to absorb water away from this first layer and push it down to the deep layer of the diapers. The third layer will be consistent of polymers, which will absorb the bulk of the urine. For example, you can see I've opened up this diaper sample here. When it's dry, and after I put in the water inside here, you can see how well this diaper has absorbed all the urine away from the surface into the deep layer of the diapers. This technology will keep the baby's skin clean and dry, even for prolonged periods. What other ways will irritate the baby's skin apart from prolonged urine irritation? Sometimes it's due to chemicals, and chemicals can be in many forms. It can be sometimes due to inappropriate toiletries, for example, using wet wipes with chemicals, or it can be using baby nappy rash creams which are inappropriate with fragrances, or baby oils with heat trapping. Even chemicals found in diapers would be a cause of skin irritation. Nowadays, we see a lot of white diapers. These diapers are all white. It's because it's been bleached by chlorine. But chlorine in diapers have been found to be a potential chemical irritant to the skin, causing dermatitis. And the breakdown of chemicals like chlorine can form dioxins, which is a carcinogen. There are some other chemicals, for example, phthalates. Phthalates are chemicals which can also cause skin irritation and potential carcinogens. Some of these chemicals can actually also affect the immune system and also the reproductive organ because it's quite close to the baby's internal organs. How would you know which brand of diapers will be free of all these chemicals? Is to find an independent body to do the studies on these textiles and material to prove that they are actually safe. If you are able to check the sources of these diapers, for example, Ocotec Standard 100, this is an independent body which actually does testing on consumer products, and they are able to give you information of the safety of the material that you use. You can check out companies like Dermatest. If the product is good for the baby's skin, it will give a high rating to ensure that this product is actually non-irritating and non-dermatitis provoking skin material.